We want to get to the heart of COVID-19's impacts here in our region. For more on that, I'll turn it over to my co-anchor, Mark Kiesling.
Thank you, Julie. We are joined tonight by Dr. Ben Rathert, Family Practice Medical Director with Christopher Rural Health. Dr. Rathert, thank you for joining us tonight. We appreciate you being here.
Thanks for having me.
Well, what are you seeing in your patients regarding COVID-19?
For us in our outpatient setting, mostly just the basic cold symptoms, runny nose, cough, I just don't feel great. One of the big hallmarks with COVID is, of course, loss of smell and taste can be kind of common with that.
So where do you draw the line between sending someone home with COVID-19 symptoms and then saying you really need to go to the hospital?
So especially this year compared to last year, they have to be pretty darn sick for us to be able to send them to the hospital and me to make that phone call and say, hey, I've got one coming your way, guys. But for the most part, everyone we're seeing on the outpatient setting there, we can say go home, quarantine, and we call them every day to check on them, that sort of thing. The health department, gets involved for the positive cases. So.
And when you say they have to be pretty darn sick, that's because there are just so few beds available?
Exactly. Yeah, it's to the point where, like, their lungs aren't doing their job anymore, and I'm starting to worry that they're not going to be all right at home,
Okay. Now, nationwide, we're seeing 25% of new cases involve children. Are you seeing many cases locally involving children?
Yes, we really are. So last year especially, kind of the going idea was, don't worry, kids aren't going to get it. That's because we just weren't seeing those numbers. This year it's a totally different story. The Delta variant especially is what's responsible for that. The kids aren't getting super sick, but there are those cases to be sure, and we just didn't have this last year, and now we've got it.
So last year we were seeing that if children did have the virus, they were largely asymptomatic.
Yeah.
And so now with the Delta variant, are you seeing those symptoms like you described before, more cold-like symptoms?
Yep, they're not usually, again, in an outpatient setting, we're not seeing the most severe cases. It's mostly the parents bringing them in saying, hey, we'd like them to be tested. And sure enough, we're getting those positives that we just did not get before. But yeah, it's runny nose, just the basic things you'd look at. And that said, we're seeing more numbers in schools, of course, too, that comes with that. So
something we're also hearing from school districts is that there are other respiratory illnesses that are going around, like RSV. Are you seeing cases of that also?
Yeah, absolutely. Those viruses magically did not go anywhere. They're still doing their thing. RSV, influenza the season's upon us. We had an influenza case just recently.
So those are something else that parents need to be aware of when it comes to children besides COVID-19.
It's not the only thing, yeah.
Christopher Rural Health covers multiple towns. Are you seeing hot spots in certain areas that you cover?
Not especially.
Okay.
Really, the going idea would be anytime there's any kind of a gathering, you may expect some numbers to come out of that. That can always be the case. Anywhere people are going to be unmasked, in close proximity, especially indoors, that's, it could happen there. We're actually offering more video visits starting back in July this time on our website, CRHPC.org, to the point where people don't need to come into the office to be seen, so we can offer that service there and potentially cut down on some spread that way as well.
Makes it a little easier on the patient as well as on the medical staff.
Yeah.
Okay. Are you seeing an increase in people through these, whether it's telemedicine or in person, wanting the vaccine?
I'd say it's steady. We definitely had a rush, when the vaccine was early available, February, March, April, and then those numbers, the rush really kind of died down and we kind of leveled off in our area, so to speak. That said, even with my patients I see on a regular basis, I usually try to throw it into the visit like, hey, did you get vaccinated there? And I get quite a few a day that'll take me up on that. You know what? I've been thinking about it. Go ahead, let's do it today. And we can do it, so we do. It's nice.
What do you tell people who are hesitant about getting the vaccine?
So a few things, but the biggest thing is I tell them that I'm worried about you. The vast majority of my patients have some kind of a comorbidity, diabetes, hypertension, heart disease, and these are all factors that if you should get sick, you may end up getting very sick. In fact, just last week I had a really great encounter with one of my patients I've had for 8 years now. She had been in the hospital for COVID over the course of the summer and was very sick. And this is the first time I'd seen her since then. We talked all about her encounter and whatnot. And then towards the end of the visit, I just kind of made an assumption. I said, oh, so you're going to get the vaccine? And she said, honey, I got the vaccine back in March. I'm pretty sure that's the reason I'm alive.
All right. That makes a difference, doesn't it? We've talked with medical professionals over the past few weeks in conversations like this, and it seems education is the key to getting more people vaccinated. Good information from a trusted source, and that trusted source is often their family physician. So how is Christopher Rural Health educating people to try to get the vaccine?
So for the most part, we're using numbers as our guide to say, well, what percentage of people in ICUs are vaccinated? It's a low number, above 90% is unvaccinated if you end up in the ICU, those kind of things. But also, kind of on the larger end of things, we're trying not to use like shame and trying to make you feel bad, like you should be doing this. Rather, we're trying to build up an environment to reassure people, say this is a responsible decision. You should do it for yourself. You should do it for your family. You should do it for everybody you care about, and society at large. It all benefits here, but we try to more accentuate the positives.
So what are some other things people could be doing in this battle against COVID-19 besides being vaccinated?
So. One of the biggest reasons we've seen the numbers go up this summer is because we all got kind of relaxed. Everyone got used to this, and quarantine's been really long, and it's summertime. We can all take our masks off, right? So that's the trouble with it there. That's how it spreads. So wear your mask. That is the number one thing that anybody should be doing after getting vaccinated. Those two things. It's still a long battle ahead of us, I'm afraid. So. It's the best thing we could do for each other.
And we're seeing more variants coming out now, and
brand new ones every day.
That's right. All right. Dr. Rathert, we sure thank you for coming and sharing your expertise with us this evening. Appreciate you being here. And this COVID conversation, as well as much more information on COVID-19, is available on our website. That's WSILTV.com.